Thank you. Good afternoon. My topic is recent advancement in artificial intelligence in the application of glaucoma management. As you know, the glaucoma is the second leading cause of blindness worldwide. Estimated glaucoma prevalence is 111 million by 2040. In our society, glaucoma is a burden because it is not easily amenable for the diagnosis, mostly asymptomatic, poor awareness, and 50 to 90% of glaucoma remains undiagnosed. The current problem is the asymptomatic disease and often diagnosed too late. Our IOP is inadequate to discriminate the normal from the glaucoma. No single most effective screening test. So, what is the solution? We have just been discussing about this overview of the artificial intelligence in the glaucoma. As we are often come across the term that is deep learning algorithm. Here, whatever the data is put inside the input layer, and after the many hidden layers, it analyzes and we give the output. It is very much precise. Now, for example, just this image analysis. Cup and disc is segmented into the 24 cross section to create the CD ratio profile. Shape of the CD ratio profile analyzed with the Origa dataset or the Ramon eye analysis software. This method shows the very high accuracy of the area under the receiving operating curve, that is 99.6 and 91 in the Origa dataset and the Ramon. Ramon is a retinal image dataset for optic nerve evaluation. Now, here we use of OCT in as an artificial intelligence tool in glaucoma. Now, artificial intelligence, when it is introduced in the OCT measurement, it has revolutionized the diagnosis. The artificial intelligence deep learning algorithm using OCT data gives a very good accuracy in detecting the glaucoma and predicting the progression of the disease. Medeiros et al. Used the spectral domain OCT to train the deep learning algorithm to quantify the RNFL thickness and OCT and the optic nerve images. This reduced the discrepancy of the diagnosis due to large and small discs and thereby reducing the variation by the human gradient. These gradings are highly reproducible and this takes less time to detect. Another novel method of detecting the glaucoma in the early stage is by the technique called detection of appetizing retinal cell, that is DARC, by SD-OCT when they are highlighted with the fluorescent dye. Similar method of convoluted neural network algorithm predicts the glaucoma progression with accuracy of 97% and sensitivity 85%, specificity is 91.7%. This technique is FDA approved. This is a use of ASOCT and with the deep learning system. Here, with this method, we can diagnose the angle closure glaucoma in the early stages. Now come to the tonometry. Here again, it is an old thing, but with a new rule. There is miniaturization of the micro electromechanical system. This is non-invasive diurnal IOP reading. We are example of triggerfish contact lenses. The application of artificial intelligence algorithm to 24 hours IOP profile for the contact lens is to discriminate the chronic open angle glaucoma from healthy eye that gives ARSC 0.6 and clearance is 0.4. Similarly, the IMET intraocular sensor also used to record the 24 hours IOL power, IOP pressure. Another non-intracameral intervention is episcleral telemetric pressure transduction. Now, another thing with is the automation of IOP estimation by Goldman applanation tonometer. Automation of estimated by the IOP by analyzing the video recording using the slit lamp microscope and Goldman applanation tonometer. Here, the DL algorithm helps to study the position of the tonometer and the Myers of the recorded videos or estimate the IOP using the Lambert formula. Now, corneal biomechanics using the ocular response analyzer and easily diagnose the open angle glaucoma. Now, there are two types, there's the ocular response analyzers. Now, come to the fundus imaging. When it couples with the data base, it gives a twist. Now, we have many iPad, iPhone based, that is DI system, and Peak Visions, IMAX, Eye Examiner, and the ocular SL phones. Now come to the perimetry. If it is it takes the help of artificial intelligence, it helps us to interpret the field vision with great accuracy and shorter time with 93% sensitivity and 91% specificity. We have the iPad-based software, that is Melbourne Rapid Field Testing, and Visual Field is easy. And the review 2 with the glasses of the virtual reality, and we can take the perimetry with this type of glasses. Now, Moorfield motion displacement test is for the glaucoma detection or is a community-based screening. Here we can, it is the community-based screening procedure. It takes the glaucoma detection very easily. Now, contrast sensitivity testing, it is a Smith-Richmond contrast sensitivity test. It also gives the early detection in the chronic open-angle glaucoma. Now, electrophysiology is the bone for the glaucoma diagnosis. Here, the N-Goggle technology with EEG correlates steady state of VEP and the pattern reversal is visual stimuli and capture the signal from the 4 OAG and 6 EEG channels. This discriminates the glaucoma eye from the normal eyes. The pattern, these are two pattern electroretinogram. Here I have shown in this picture. Now, come to the community application. Here, first of all, we optic disc-centric fundus photography acquisition through Remedio non-magnetic fundus phone with handheld camera. It is a satellite hospitals, and it is transferred to the main hospitals and for the screening. In the vertical coverage ratio, if it is less than 0.5, it is non-referable. It is more than, then it is referable. Even the IOP more than 21 millimeter per AG is also referable. Now, at the base hospital, we go for the higher diagnostic tests, and we can get the diagnosis of glaucoma with more precision. Now, artificial intelligence helps in detecting the glaucoma by detection of the glaucoma disc from the fundus images, analyzing the RNFL thickness from OCT images, studying the angle structure of ASOCT, studying the visual field images for detection and estimating the progression of the glaucoma, and automated IOP estimation by Goldman appellation tonometer. There are current limitation also, adversarialization of and black box artificial intelligence, detection of multiple diseases, and need for standard guideline to diagnosis of glaucoma, needs human intervention, and need for quality training.
GOPAL, can you sum it up, please?
Now we have many coming diagnostic tools. Now we have got a bright future ahead of us.